Hello, this is Dr. Bryson, and this is a video for the Contemporary Issues and Trends in Criminal Justice class, which is a graduate level class. In this video, I wanted to talk about risk assessment, and I'm going to apply this to sexual offenders. Now, we've already talked about in this unit, if you watch the videos in order, the containment model of sexual offending. Now, the leader of the containment model team is the supervising officer. That is the probation officer or the parole officer. Um, the other members of the team are the therapist, who should be a specialist in sex offender treatment. Okay, in other words, the treatment is focused on the sexual offending behavior. We're not treating the depression of sex offenders. We're treating their sexually offending behavior. Let me kind of put it this way. I might have a heart issue and um, let's say a joint issue. I'm going to go to an orthopedic surgeon for my joints. I'm going to go to a cardiologist for my heart. I am not likely going to be followed by a general practitioner for either of those problems. They might have a minimal knowledge of those things, but they don't have the specialist knowledge. You need to have a sex offender treatment specialist being the therapist. And then when it comes to the polygraph, general polygraph won't cut it either. There is specialized training for those individuals who do what we call post-conviction sex offender testing, or PC-SOT, of sex offenders. They are taught how to ask questions the right way. So, for instance, let's say, so did you touch that person for sexual pleasure? Well, how the offender interprets that in their mind, they might have done that, but they could get a truthful reaction on the polygraph by saying no, when in fact they did touch that person for sexual pleasure. But there are differences in definitions. The point is that a specialist in sex offender polygraph is trained in how to word the questions better. So it's important to understand that. Now, the sex offender treatment specialist, the licensed therapist who, and they need to be a licensed therapist, who has specialized credentials. Now, I actually have the specialized credentials through the National Association of Forensic Counselors. I hold the clinically certified sex offender treatment specialist credential, CCSOTS, or we normally say it as CC-SOTS. But that is a very difficult credential to get. I had to prove that I had so much experience, and I had to pass a test. I had to take a test for that. So it's important to understand the significance of using specialists who know what they're doing with sex offender treatment. Now, I say that because I have heard here in West Virginia there are county agencies, in other words, agencies run by counties that claim they're doing sex offender treatment because it helps them make a buck, but they're not hiring the true specialists. Unfortunately, the way that clinical credentials are run right now, the individuals can get away with that. Now, they should not be able to. Technically, if someone files an ethics complaint to the board, they should have to prove that they have the credentials to work with sex offenders. Unfortunately, our licensing boards currently will say things like, well, we don't require specializations, and they don't really follow through at this current time. Okay, so let's jump into risk assessment. Now, this typically in West Virginia will be done by the treating therapist, the person who specializes in sex offender treatment. Now, there are folks that specialize in forensic mental health, and then there are folks that specialize in sex offenders. It's kind of a subspecialty because general forensic mental health is very different than sex offender specific mental health. Yes, there are some some overlaps. I will grant that, but it's also important to understand that there is significant difference. All right, so I am going to share my screen. So now you should be able to see the PowerPoint called Risk Assessment in Criminal Justice. So this is true of all risk assessment, but I'm going to point out as we go through this issues related to sex offenders. So first, what is risk assessment? Well, we need to understand that there's what we call actuarial risk assessment versus clinical judgment. Clinical judgment is I feel this person is a danger. So actuarial risk assessment is where we do research, we collect data on specific factors, and we have a set way of scoring those factors so we know if someone is high or low risk. For example, when I was a teenager, turned 16 in 1980. In those days, you couldn't even get your learner's permit to your 16th birthday. So I got my learner's permit on my 16th birthday. Because we had a red car in the family, when my father added my name to the insurance, it went up a whole lot more than if we had all blue cars or all black cars. Why? Because the insurance companies knew that the factor of being a teenager in a red car cost them more money. They'd done their research. Their actuarial tables told them that teenagers driving red cars have more accidents than anybody else. That was a fact that they determined. So, a teenager driving a red car was going to have much higher insurance premiums. So do you see how actuarial risk assessment works? They've been doing it in insurance for years. Okay. We have what we call the R&R model. Now, you'll notice the first one says static and then risk in parentheses. The second one says dynamic and then needs in parentheses. So R&R stands for risk, needs, responsivity. So static factors are things that treatment cannot change. Now, they might change over time. For example, age is one of the factors. You cannot treat age. Age simply changes. There's no effort you can do to keep it from changing or to make it change. It will change. Every second it changes. You're a second older every second, right? But because we can't do anything to change it, it is still a static factor. So static factors can get worse, but not better. If we, in other words, the things that we can do something to change, we can't make them better. So what is a static factor that we can make worse? Previous sexual offense convictions. You can never make that better. If you had 2 in the past, you always had 2 in the past. Even if you get your record expunged, you still had those 2 in the past. That is a factual piece of information. You still had the 2 in the past. So you can't make that better. Now, you can make it worse by committing more offenses. Now, here's the thing. The static risk factors have much more robust research support. But even with that robust research support, static factors have a moderate predictive value, meaning that it's better than anything that we have, but it ain't good enough yet. Now, unfortunately, too many treating therapists out there don't quite understand that. And they just say, well, look, they're low risk. Well, using tests that have moderate predictive validity. Okay, dynamic needs. Dynamic is opposite of static. Static are things that don't change. Think of static cling. It sticks to you. Dynamic things are things that don't stick to you. They can change. We can fix them. In fact, not only can they change, they likely will change. Treatment can change them. So, which means these are factors that we know that are related to risk of recidivism or committing more sexual offenses. or in general criminal sense, general criminal offenses. So we can treat these things. And the idea is if we change these factors, that the person is going to be much less likely to commit another offense, either criminal or sexual, depending on which kind of assessment we're doing. Now, here's the thing, we don't have a lot of research into, okay, we've treated these dynamic needs and we've made them better. Now let's look at if treating these dynamic needs actually does reduce recidivism. We've not really looked at that. So we don't know if that theory is, or that hypothesis rather, is accurate. But it does give us a focus for our rehabilitation efforts. In general criminal recidivism, we know that, as well as in sexual offending. Now, dynamic needs can get worse or better. So one dynamic need for both general and sexual criminal recidivism would be substance abuse. That can get better or that can get worse. Now, the thing is, we have less robust research support for this. And again, I've already pointed this out, less research on whether improving them translates into less offending. All right, and then the third one, which we really don't have any research on, are responsivity factors. So very strong lack of research support on this, but these are factors that would interfere with improvements in the dynamic needs or that interfere with the individual's response to treatment or to rehabilitation attempts. For instance, if a person has a developmental disorder, let's say that they have intellectual deficits, well, they may not be able to understand some of the treatment that we're giving them. So that would affect their ability to respond to treatment. Let's say that the person has antisocial personality disorder. One of the things we know from research is that when someone with antisocial personality disorder goes into treatment, they become even worse at their ASPD. Now, why? Because they learn even more ways to manipulate. So having antisocial personality disorder is considered a responsivity factor. Okay, these are things that might get in the way. So as we're doing treatment, we try to do things to control for that. All right, so static, dynamic, or responsivity. Let's think about some of these factors. Which is it? Can you and also think about which criminological theory relates to the factor. Now, you should have already had criminology in your undergrad. It's a class you should have had. So, criminal history, is that static, dynamic, or a responsivity factor? Now, I want you to think in terms of, can treatment change it? If treatment can't change it, is it static or dynamic? It's static if treatment cannot change it. Okay, so this is a static factor. Education, employment history. Is that something that can be fixed or not? Somebody has a poor education. They didn't graduate high school. Now, this particular one does not relate to sexual offending, but it does relate to general criminal offending. Well, yes, we can fix education. If they didn't graduate high school, they can still get a high school diploma. So that is a dynamic factor. Family or marital relationships. Well, obviously, people go to marriage counseling and family therapy all the time. So those can be fixed, right? So those are dynamic. Leisure recreational pursuits. Again, those can be fixed. Those are dynamic. Companions. You can change your companions. That can be fixed. Alcohol drug problem. That can be fixed. Pro-criminal attitude or orientation. This one is a little tricky because this one is both a dynamic factor and a responsivity factor. It's something that we're going to treat, but it also affects the person's responding to treatment. So this one would fall under both. Antisocial pattern in their life. Well, they've already had the antisocial pattern, so that can be fixed, but that takes time. So it is dynamic, but in some ways it's also static. Psychopathic personality disorder, or that's a better way of saying it. Um, um, Antisocial personality disorder is what we use here in the US. In Europe, they have two different things: antisocial personality disorder and psychopathic personality disorder. Psychopathic personality disorder is the worst of the two, but that is likely a responsivity factor. Intellectual deficits, responsivity factor. All right, so what are some of the limits of risk assessment? Well, we have to remember the dark figure of crime and recidivism rates, or what I call the dark figure of recidivism. Interesting thing is, if you talk to a lot of researchers who do sex offender work, they will tell you that the recidivism rates among sex offenders are very low. But they're not considering the dark figure of recidivism. Now, when we say the dark figure of crime, what do we mean? You should have learned this in your Introduction to Criminal Justice class, your freshman year of undergrad. The dark figure of crime are all those crimes that get committed that never get reported, so they do not show up in crime stats. Now, here's the thing about sexual offending. Sexual offending is probably the most secretive of the crimes. There are likely so many sexual offenses, especially against children, that happen on a daily basis that never get reported, that what we do know is probably the tip of the iceberg because they are so secretive. So now imagine this sex offender molested children in the family. They go to prison, but this sex offender had a very good income and it affected the family's standard of living while this offender was away. And it had a very serious effect on them. And then they got made fun of at school for being a victim because that does happen. And then the offender comes back and they start reoffending, but they never get reported because the children think that it's worse for the offender to be away than it is to endure the molestation. That is a strong reality. In other words, those offenders get caught the first time, but their recidivism never gets reported, so they don't show up in recidivism rates. So the risk assessments we have for sex offenders are moderately good. But when you tack onto that the idea of the dark figure of recidivism, then we must always take the risk assessment with a grain of salt and recognize that all risk assessments are underestimates of likelihood of committing more sexual offenses. So that's one of the limits. And the limit isn't that they likely under represent. The limit is that the folks that do the research fail to recognize that they underrepresent. Okay. But these risk assessments also fail to address individual characteristics. In other words, there might be something that is a risk factor for this individual, but not for the larger population. So it's important for us to understand that part of it. All right, so in sum, risk assessment can help inform the level of supervision and identify targets for rehabilitation. In other words, if someone is high risk of reoffending, they're going to get much more intensive supervision than someone who is low risk. But someone who is low risk, we're not going to assume that we can forget about them. We're going to watch them too, because high risk offenders at one time would have been low risk. We must always remember that. But then we're also going to look at the risk factors and identify targets for rehabilitation. Now, research cannot address the dark figure of recidivism or undetected recidivism. We have to always remember that, okay? All right, so I'm going to stop the screen share. Now, if you work with sex offenders, then you're going to need risk assessments. So I will put a list of them in Brightspace. But there is one called the Static 99. Now there are newer versions. So 99 meaning 1999, the year that it was created. But the Static 99 has the best research for it. We then have um, uh, the Acute 2007, which is about acute risk factors, meaning, and these are for sex offenders. These are risk factors that they are in a lot of danger of imminent reoffending. By the way, the single greatest factor of imminent risk of reoffending is substance use. That's true of all violence, whether it's domestic violence, whether it's violence against folks you don't know, whether it's sexual abuse. Substance abuse is the single most valid factor to predict that someone is at very imminent risk of committing more violence. Okay. And then we have the Stable 2007, which is a dynamic risk assessment instrument as well. So the Stable and the Acute were developed together. The Stable are factors that are dynamic that we can change through treatment, but they tend to be stable over time so that treatment is ongoing to treat those. The acute factors are things, they are at imminent risk right now. We better do something to prevent them from committing another offense. So if an offender gets drunk, we might give them a 30-day shock incarceration. And depending on the jurisdiction, the probation officer can do that without the judge's approval. The parole officer can do that without parole board approval. So they go to jail for 30 days. They're only going to be there for 30 days. And that gets them away from the alcohol and away from the ability to commit another offense. So they're going to be sobered up by the time they get out. Okay. The stable factors are things that we do in the ongoing treatment. Now, there is a fourth risk assessment tool called the CPORT, the Child Pornography Offender Risk Tool. And because the Static 99, the Stable, and the Acute, those three can only be used for qualifying sexual offenses, typically called hands-on offenses. Now, creating child pornography is considered a hands-on offense, even if you did not put your hands on the person. But the folks that they're simply searching for child pornography online and they're trading it with others, but they don't have anything to do with the actual manufacture of it, the Static, the Stable, and the Acute cannot be used with them because they were not included in the sample or in the very large samples that were used to create the Static, Stable, and Acute. For one good reason, because when they were created, online child pornography was nowhere near as prevalent as it is now amongst convictions. In other words, we hadn't caught near as many people as we have by now. So here we are almost 20 years after the Stable and Acute were released, and we have a very robust sample. So the CPORT was created. Now the CPORT is only used for folks who have child pornography offenses. Now, it can be used for folks who also have hands-on offenses, but it can be used for folks who have only child pornography offenses as well. So we use that as well for those individual offenders. So those are the four main ones. Well, I know this video has gone a little long, but remember, this is a grad class, so you should expect more longer videos. Or let me rephrase that. You should be expected to tolerate longer videos as a grad student. All right. Well, we will see you next video.